10 causes of cerebral palsy. Number 1. Brain injury. The most common cause of cerebral palsy is brain injury that takes place during the developmental phase of the brain. As mentioned earlier, brain injury can occur both during birth as well as before or slightly after. One of the consequences of brain injury is the development of cerebral palsy in the patient, affecting things like muscle control, muscle coordination and muscle tone. Brain injury may also affect posture and balance. Some patients can have difficulty speaking as a result. The overall impact of the brain injury will determine the severity of the symptoms. Number 2. Jaundice. Jaundice occurs when there is too much bilirubin in the blood. Under normal circumstances, bilirubin is filtered out from the blood by the liver. However, newborns' livers often start functioning only a few days after birth. Afterward, the liver starts working regularly. However, in certain cases the liver doesn't start performing its function, causing long-lasting effects on the development of the infant, including cerebral palsy. That's why it is so important to evaluate the health of a newborn correctly, to ensure adequate function of all organs. If left untreated, jaundice can cause severe brain damage. Number 3. Difficulties during labor. It is often difficult to determine the cause of cerebral palsy because it can vary wildly from one person to another. In some cases, cerebral palsy may, in fact, be caused by difficulties during labor, including an insufficient amount of oxygen during or after birth. Other factors, such as the duration of labor, can cause cerebral palsy. A labor that lasts for more than 18 hours is considered a risk factor in the development of cerebral palsy, especially if there is more than one birth taking place. If the baby is dropped soon after birth, this may also be a cause of cerebral palsy. Number 4. Infections during pregnancy. Another common cause of cerebral palsy has to do with infections during pregnancy. These infections may damage a fetus' brain development as well as the overall development of the nervous system. Related conditions include German measles as well as herpes-type viruses. There is also a range of other infections that can affect an infant's brain development during pregnancy. If left untreated, cerebral palsy may occur. Not all infections cause brain damage, but if they do, it is important to treat it as soon as possible to reduce the extent of the damage. Number 5. Prematurity. Among the most common causes of cerebral palsy is prematurity. Premature babies have a much higher risk of getting cerebral palsy due to the development of the brain as well as other factors that affect their overall development. Premature babies that weigh under 3 1/3 pounds are 30 times more likely to suffer from cerebral palsy than other healthy babies. One of the most common problems related to premature birth is bleeding in the brain, which can be especially harmful to the delicate tissue of the brain. Destruction of healthy brain cells may also occur. Number 6. Brain lesions. Brain lesion may often be the cause of cerebral palsy. A brain lesion is a defect that occurs from injury or damage to the brain. diseases may also cause brain lesions. During fetal development, brain lesions can have a significant impact on the overall development of the brain, and they may lead to cerebral palsy. Many factors may cause brain lesions during this stage, including toxins, asphyxia, and certain infections. Brain tissue death is another consequence of brain lesions. It's important to treat any infection as soon as possible as to reduce the chances of developing cerebral palsy. Number 7. Brain malformations. Brain malformations are largely to blame for the development of cerebral palsy. A brain malformation is a defect that happens during the abnormal development of the brain. Malformations of the brain are most likely to occur during the first 20 weeks of fetal development, although they may occur any time during the developmental phase. If there is a malformation in the brain, it may affect the development of the brain, and it may also result in abnormal growth or inadequate brain division. To evaluate the health of the brain, different scans can be performed, such as an MRI. Number 8. Blood diseases. Diseases of the blood may cause cerebral palsy to occur. One of the most common diseases of the blood that causes cerebral palsy is known as right hand disease. This condition causes the blood of the fetus and the mother to be incompatible. As a result, jaundice and brain damage may occur, which leads to cerebral palsy. The good thing is that right hand disease can be prevented with an injection during the 28th week of pregnancy. There are also other conditions of the blood such as thrombophilias, a blood clotting disorder, that may increase the risk of cerebral palsy. Number 9. Acquired cerebral palsy. Acquired cerebral palsy refers to the development of the condition within 2 years of life. Not all cases of cerebral palsy are caused during or before birth. In fact, around 10% of children with cerebral palsy develop the condition after birth. The cause usually has to do with injury, which usually occurs within 2 years of birth. Such injuries are often due to infections of the brain, like meningitis. Head injuries are also another culprit that can cause cerebral palsy to develop after birth. It is important to take measures to reduce your child's risk of developing cerebral palsy. Number 10. Other congenital disabilities. There are numerous other causes of cerebral palsy that are related to certain congenital disabilities. It's important to know that each case is different, and the symptoms, as well as the extent of the damage, can vary largely between individuals. One of the factors that are most likely to increase the risk of cerebral palsy is brain malformations, which usually develop before birth. Other things, such as genetic diseases, may also increase the chances of getting cerebral palsy. Lastly, congenital disabilities of a physical nature may often cause cerebral palsy to develop. Obtaining a precise diagnosis is important for future treatment.